This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Hosit FCM Injection is an effective treatment for iron deficiency anemia. It helps manage symptoms and improves overall health. Indications and uses. This injection is indicated for the management of iron deficiency anemia in adults and children over the age of 14 who are unable to take oral iron supplements, have an intolerance to oral iron, need a rapid iron boost in their body, or have non-dialysis-dependent chronic kidney disease. It is not recommended for use in children under 14 years of age, and caution is advised for elderly patients. How it works. The injection contains iron 3-hydroxide complexed with carboxymaltose, which effectively releases iron needed for hemoglobin synthesis and increases red blood cell count. Directions for use. Hosit FCM injection will be administered by a healthcare professional as an intravenous injection or infusion. The physician will determine the appropriate dosage and duration based on individual factors such as age, body weight, and the severity of the anemia. Possible side effects. Common side effects may include headache, dizziness, flushing, high blood pressure, nausea, and site reactions upon injection or infusion. Precautions and warnings. The injection should be used with caution during pregnancy and breastfeeding. Patients with chronic kidney disease, liver disease, severe asthma, and those with allergies to ferric carboxymaltose should consult their doctor before administration. FAQs. 1. What is the use of Hosit FCM injection? It is used to correct iron deficiency anemia in eligible patients. 2. How long does it take to improve hemoglobin levels? Improvements can be seen in a few days to weeks. 3. Are there any common side effects? Yes, headache, dizziness, and nausea are common. 4. Is it safe for patients with liver problems? Caution is advised, consult your doctor. 5. Can I take other medications with it? Inform your doctor about any other medications or supplements you are taking. Thank you for watching. We hope you found this information helpful. If you have any questions or suggestions, please leave a comment below.